This is roll number 46, Mamta Bhagat. My topic is prostaglandin and leukotrienes from chapter 6, Autocoids and Respiratory System. Prostaglandins. PGs are the product of long-chain fatty acid. Arachidonic acid is the precursor of biosynthesis of all PGs. The enzyme involved in the formation of PGs from arachidonic acid is cyclooxygenase. The main PGs are PGE2, PGF2-alpha and PGI2. Another class of substance obtained from arachidonic acid by the action of lipooxygenase is leukotrienes. There are two forms of cyclooxygenase called cyclooxygenase 1 and cyclooxygenase 2. Cyclooxygenase 1 is constitutive and is widely distributed. It participates in various physiological functions such as production of gastric mucosa, hemostasis, and regulation of cell division. Cyclooxygenase 2 is induced during inflammation by cytokines and endotoxin. Pharmacological action and uses. First, GI tract. PGE2 and PGI2 reduce acid secretion and increase the secretion of mucus in the stomach. Cytoprotective action. Misoprostol PGE1 analog is used for the prevention of NSAID-inducer ulcers. Second, cardiovascular system. PGD2, PGE2 and PGI2 causes vasodilation. PGF2-alpha constricts pulmonary veins and arteries. TXA2 is a vasoconstrictor. PGE1 is used to maintain the patency of ductus arteriosus before surgery. B. Prostacyclin decreases peripheral, pulmonary and coronary resistance. PGI2 epoprostenol is used to treat pulmonary hypertension. Other PGI2 analogues useful in this condition are treprostinil and iloprost. Third, platelets. PGI2 inhibit platelet aggregation. Hence, it is useful during hemodialysis to prevent platelet aggregation. Fourth, eye. PGF2-alpha has been found to decrease intraocular tension. Its analogues, example, latanoprost, bimatoprost, travoprost, and uniproston are used in glaucoma. Fifth, uterus. PGE2 and PGF2-alpha contract pregnant uterus. PGs are mainly used in mid-trimester abortion, missed abortion, and in hydatidiform mole. B. Induction of labor. PGE2 and PGF2-alpha can induce labor at term. C. Cervical priming. PGE2, PGE1 and PGF2-alpha promote ripening of the cervix, make the cervix favorable for induction and facilitation of labor. D. Postpartum hemorrhage. PGs increase tone as well as amplitude of uterine contractions. Carboprost, 15-methyl PGF2-alpha, can be used to control PPH. Sixth, male reproductive system. PGE1 alprostadil is used in the treatment of erectile dysfunction. Therapeutic uses of prostaglandins in obstetrics. First, abortion. PGs stimulate uterine contraction and cause ripening of the cervix. Dinoproston is used for induction of mid-trimester abortion, missed abortion, and hydatidiform mole. Misoprostol can be used in combination with mifepristone or methotrexate to induce abortion in early pregnancy. Carboprost is used to induce abortion in second trimester of pregnancy. Gemiprost, PGE2, and Dinoprost, PGF2 alpha are also useful for inducing abortion. Second, induction of labor. PGs can be used to soften the cervix for induction of labor. PGE2 can facilitate labor by softening and dilatation of cervix. Third, PPH. Carboprost and misoprostol can be used to control PPH. Adverse effects. They are nausea, vomiting, diarrhea, fever, flushing, hypotension, and backache due to uterine contraction. Injections are painful due to sensitization of nerve ending. Leukotrienes. These are obtained from arachidonic acid by the action of lipooxygenase. Leukotriene antagonists. Leukotriene receptor antagonists. These drugs competitively block the effect of cysteine leukotrienes LTC4 and LTD4 on bronchial smooth muscles. Thus, they produce bronchodilation, suppress bronchial inflammation, and decrease hyperreactivity. They are well absorbed after oral administration, highly bound to plasma proteins, and metabolized extensively in the liver. They are effective for prophylactic treatment of mild asthma and moderate persistent asthma in combination with other drugs. They are well tolerated, produce few adverse effects, headache, skin rashes, and rarely eosinophilia. Zeolatin inhibits 5-lipooxygenase and is administered orally. Hepatotoxicity restricts its use. That's all. Thank you.